Joining us is Pierre Cyr. He's the NDP candidate for Etobicoke-Mactaquac. He joins us from his home via Skype in Grand Falls, New Brunswick. Pierre, we're discussing healthcare in Canada. What is the state of healthcare services in Canada, and what is the NDP policy?
Well, mainly we should be addressing what are the problems with healthcare. What works. Definitely, nonprofit hospitals, transparent accountability, professional accountability by those providing the services. But we know that the biggest problems with healthcare in Canada is related to the evolution of pharmacology. Pharmacology is basically pills, right? Medications. More and more treatments are coming in the form of medications, but Medicare doesn't cover medications unless you're in a hospital setting. Many people find themselves with horrendous bills if they don't have private coverage. And we have the same problems with private coverage in medications in Canada as the Americans have with all their healthcare issues in the US, which is, deductibles, high premiums, getting cut off from if you lose your job, and so on and so forth. These issues need to be addressed. Now, people keep talking about the costs and how even with whoever gets reelected, it doesn't matter. They recently said that all the parties will promise a 6% escalator clause because again, it's a service that's provided provincially, but there's federal funding component. So the federal government has not only just a say via the Canada Health Act, it has funding requirements to all the provinces for the service. And so the issue of pharmacology is that we have to expand coverage of Medicare. Now everybody's saying, well, we're increasing costs by 6% a year just to maintain the current system. That's unsustainable. The population is aging, but actually in terms of GDP, we're still below what we were in the 1950s when it was a private system, where back then we spent about 12% of GDP, 12 to 12.5 according to some studies. And today we're about, a little bit over 11%. We were down to 8 or 9% at one point. And it is increasing because of the aging population. But that's a natural evolution, right? 85% of healthcare is consumed by people over the age of retirement age. And those people that proportion of the population is growing. The number of people over in the retirement age is growing. It's a natural economic evolution. So why can't we just continue to do this through the most affordable system we know, which is nonprofit Medicare, to cover the increases that will occur? It's simply like, when you're an adult, you're raising a family, you're spending money on a house, on a car, on so on and so forth. You're trying to get the best deal for your buck, right? Whatever it is, whether it's in a for-profit system or a non-profit system, you want the best bang for your buck. So why can't we just project that into that same population now moving into retirement age and becoming consumers of healthcare? And we know for a fact, and there's no debate about this, that nonprofit healthcare is the best bang for the buck. It's also high quality. We have better results than the for-profit systems that we find elsewhere. So any problems that we find, waiting lists and such, the lack of coverage like Pharmacare, these things simply should be taken on, and we should make that leap to expand Medicare to be a completely well-rounded system, and simply move people who are paying private premiums into a tax system, which would be less than what they pay in private premiums, to gain that much fuller coverage as well. Because many private systems only cover certain medications to a certain point. You get cut off, and medication costs $30,000, $40,000, $50,000 a year because you have a very debilitating disease like cancer. You also gain with a large public system, even if it's only provincial, although hopefully in the pharmacare sense, we hope it evolves to become a truly national program, is you can do bulk purchases. When you buy these things in bulk for the entire nations, you get massive savings. Everybody knows, who has ever had any business knows this. The more you buy, what do you get? You get a deal on the per unit price.
Now, looking at it from your perspective, obviously you're a healthcare professional. You come from a family of healthcare professionals. So you're very well versed in this, because this is something you see every day in your job at the Manor. Now, let's drill down a little bit more towards specifically for Etobicoke-Mactaquac, aging population. And people are, it's like people are literally moving into that older generation. How is this going to affect, or what policies does the NDP propose that it's going to affect people in Tobique Mactaquac directly?
Well, anything regarding health is going to be a national policy. There won't be any kind of targeted policy for writing on a healthcare issue, unless if there was a local healthcare issue, like I don't know if there was an area which had a much higher rate of heart disease. Well, then you can target healthcare dollars or interventions. But again, that's because it's a provincial jurisdiction. The role of the federal government is in helping to finance what the province delivers. But in the case of pharmacare, I would hope that it would be a national program, so that it would expand and help to cover all Canadians even more equally. Because even though the federal funding helps to make relative access to Medicare, to healthcare equal in provinces, I think it's pretty obvious from what I've heard that some Canadians moving to other provinces get better coverage than others. I've heard of patients in northern New Brunswick getting addresses in Quebec because Quebec has better coverage, and so doctors would get a postal address or an address for their patients in Quebec in order to get essential coverage for their patients. Things like that is shouldn't have to exist. It's like Americans coming here for who have dual citizenship, who come to Canada to get treatment because they can't afford it in the U.S. These situations shouldn't have to exist, especially not within the context of a nation.
Now, do you see any major changes taking place depending on the results of the election? Obviously, we don't know. We don't have the crystal ball.
Yeah, we know that Jack Layton's already promised more monies for doctors and nurses. That's part of the answer. We need more bodies on the ground. You're going to need even more of these professionals as more and more people age and more people get the diseases and the problems of age. We're definitely going to have to invest even more in facilities and whatnot to guarantee reasonable and timely access, which is still an issue. I think it's a matter of a societal choice. We're going to have to spend in terms of GDP more and more money. The Americans are spending more and more money in their healthcare. So is every other Western country. It's the economic evolution of an aging population. Now, it doesn't mean that this demographic needs to continue to evolve in that direction. At some point, things have to stabilize, because we're not going to forever get older forever. In terms of demographics, we're going to have a policy that also promotes childbearing, because population rates of reproduction have dropped like a rock. I mean, one of the reasons that the population proportionally is aging is people that have fewer kids. I mean, we're down to 1.5 kids per couple. Well, there are countries in Western Europe that have invested heavily in income supports, childcare, other national programs to help encourage people to maintain a reasonable reproductive rate of around 2.1, 2.2 child per couple, to at least stabilize the population. And at that point, you get, at some point in time, may take a generation or two, you get a stable population structure which can maintain itself over the long term.
But right now,
that's another societal choice. Do we really invest in childcare and income supports and family supports in order to make sure that we don't have collapsing demographics, like, for example, in Japan, which has only about 1.1 child per couple, and so their demographics are disastrous. Their population is rapidly aging, and they are going to have gigantic problems in terms of dealing with a very old population on average. Then even we will.
Yeah, but right now what we're going through is, the snake that ate the mouse. I mean, that's going through the snake right now, because it's the baby boomer generation.
Right. There's a boom in childbearing exactly after the war. Yeah, no, I understand. There's going to have to be a stabilization. But, where the pendulum swung maybe a little high, we had large families in the past. They're the pendulum is swinging very low. Now we're having almost no kids. At some point in time, we're going to have to decide as a society, do we value profit for enterprise or for business, for corporations, to such a point that we will make it difficult for families to raise more than one child. I get a lot of people telling me that, I would love to raise two or three kids, but I raised one and it cost me a fortune because I want to raise that child properly in the context of a modern world. I mean, we don't want to leave the kid not without, all the essentials that he will need to prosper.
Right.
Whether it's health, the child's health, it's education, it's upbringing, whatever. All that's part of the answer to the chance of healthcare. But of course, there's another problem with our writing as well, besides the general fact that in Canada it's 1.5 children per couple. The general fact is also people are leaving this writing because there's no economic opportunity, and that's making the aging process much faster for rural writings like ours than it would for, let's say, downtown Toronto or Montreal.
Right. Well, I know we could talk about this for days on end, but we're just about out of time. Pierre Cyr joining me. Pierre Cyr is the NDP candidate for Tobic-Mactaquac, joining me via Skype from his home in Grand Falls and talking about healthcare in Canada.